Hey guys, can you see me? Can you hear me? Am I audible and visible? Hello, hello. Hey guys, am I audible and visible? Hello, hello everyone. So welcome back to one more session of RRR. Hey guys, am I audible and visible? Hello, hello everyone. Sorry, the voice. Fine. Okay. Let's start. So today we are going to see the molecular hallmarks of a cancer. See, we already know how to name a tumor. That's what we saw in the first one. And yesterday's video we saw about the microscopic appearances and also how to differentiate a benign and a malignancy, right? Just to recap and see how many of you are still on the go and how many of you are understanding and using the session. Good evening, Swati. I'm having an ectopic rest of tissue in Meckel's diverticulum. What do we call it? Good evening, Nayak. What do we call it? We call it perfect. We call it a choristoma, right? Amazing. So, good evening, Lion. So, I'm having a tumor which is malignant arising from a smooth muscle. What is the name given to it? Just to recap, just to make sure we our basics are rock solid so that we can go and build the building whatever we want. We call it a malignant neoplasm arising from a smooth muscle. We call it leiomyosarcoma, right? Great. Fine. The next one, uh, what are the four microscopic findings where we discussed yesterday, which is a hallmark of an abnormal tissue or dysplasia? Hallmark of an abnormal tissue or dysplasia. What are the four microscopic findings? We have pleomorphism, high NC ratio, mitosis, typical, atypical, and loss of polarity, right? Okay, last question before we go to today's topic. Is dysplasia reversible or irreversible or both? Samantha, basement membrane invasion is for cancer, right? I'm just asking for dysplasia. What are the four findings? Dysplasia reversible, irreversible, or both? Dysplasia is both reversible and irreversible because the early grades or the low grade dysplasia is reversible and the high grade dysplasia is irreversible, right? Perfect. Let's go to molecular hallmarks of cancer. The entire chapter of Robbins will be about the molecular hallmarks, and we will be applying these concepts whenever we read any cancer in systemic pathology and hematology as well, right? I have a story for molecular hallmarks, the personal story. It's a very interesting one for us to remember the molecular hallmarks. Samantha, anaplasia means absence of differentiation. That's the worst degree of dysplasia. You can keep it like that, right? Okay. So this about just the molecular hallmarks. So I want to create a story around it so that it's easy for us to remember. There are totally 8 molecular hallmarks of a cancer. This might come as a long answer for you to enumerate all the molecular hallmarks of a cancer, giving a history of some random cancer, right? Let's assume there was a mother, right? Amazing mother. All the mothers are amazing, right? And there's a tiny kid. Let's assume a 6-year-old kid. Okay, a tiny 6-year-old kid and an amazing mother. So this kid, it's a kid, right? 5 year, 6-year-old kid eat frequently, right? Let's just assume the kid was eating 4 to 5 times a day food. Okay, this mother was also very happy feeding the kid 4 to 5 times a day. Unfortunately for the mother, this kid became a little bigger, right? It became a bit chubby. I don't know how to draw a chubby kid. Remember, it's a chubby kid, right? Society always changes. We don't change. We're always chubby from birth and even in adult life. When we become adult, they call us grades of obesity, right? Anaplasia is more harmful, Samantha. Right? So this mom thought that okay, the kid is chubby. Let me reduce the food intake, right? We will relate all the 8 classical molecular hallmarks of malignancy with the story, right? The mom reduced the food intake. Said okay, you eat only 3 times a day. I don't want you to be chubby, or I don't want you to be fat. Fine. So the kid was eating 3 times a day, but it was becoming more chubby, right? Let's assume this is more chubby kid. The food intake reduction was not doing anything to the kid. Kid was becoming more chubby, fine. Great, Bobby. So the mother's like, okay, fine. It's a kid. It'll become normal when it become an adult. When it becomes an adult, it'll definitely undergo keto diet, paleo diet. It will become normal, right? So the kid also had constipation. Then the mother was worried. Mother was worried. Okay, Food is going inside, nothing is coming outside. Especially in kids, constipation is a huge problem. The mother was worried, right? After the kid was constipated, I'm sure you must have been constipated in life, right? Do you think you'll go to a doctor for constipation or no? Answer honestly. Obviously, no, right? This mother also didn't take the kid to the doctor. As usual, there's a universal remedy for constipation in India, which is your banana and water, right? Banana and water. It's worst degree of differentiation, right? That's why it's not good for the prognosis, right? Same, same thing your Harrison says. If you go and look at Harrison, the first treatment for constipation is high fiber diets and liquids. That's what banana and water or milk literally means, right? So this kid, constipation didn't take care, right? Obviously, banana water didn't work and went to the first available doctor. Obviously, the first available doctor for us is pharmacist. Tell me an honest answer. I want a very honest answer from you, and I want you guys to comment to understand the reality. If you ever have a constipation or a subtle fever or just a sore throat, you would go to the pharmacist or you'll go to the doctor. Honestly, you'll go to the pharmacy, right? If you're not a doctor, what will you do? If you're not a doctor, you go to the pharmacy, take a Vicks, take a Dolo 650, if required antibiotics, and go away, right? This is what the entire country does. Just because you and me have an MBBS degree, we cannot change people's mindset. That's how they will be. That's how they'll be for sure. Right? Don't expect them to change because your expectation for them to change will make you a little bit down. That's how it happened. Don't worry. Pharmacists might not work always. If it works, you're not required that. You're much more knowledgeable, much more, your time is much more valuable, right? Unfortunately, this pharmacist didn't take care of it, and obviously they came to a doctor. When they come to a doctor, the 6-year-old kid was 50 kg in weight. It is keep on putting on weight. They said, okay, I'll take care with natural medicines. I'll take care with pharmacy. I said, "Look, everything is fine." Let came to a doctor. Came to a doctor. He was sitting in front of the kid. 6-year-old kid, 50 kg in weight. What will you do? Mom is in tears. 6-year-old kid, 50 kg weight. What will you do? We have an amazing name, right? Idiopathic. If I don't know something, we call it an idiopathic thing, right? Or put an idiopathic cause of obesity and label it. The newer name for idiopathic is metabolic syndrome, right? We always blame the metabolism. We don't look at the disease holistically. We call it a metabolic syndrome. Every metabolic syndrome, diabetes, hypertension, hypercholesterolemia, acquired conditions, heart attack, stroke, all these are components of metabolic syndrome, right? Complications and components of it. In metabolic syndrome, the biggest problem is diet or metabolism. Again, I want you to comment to know the reality. What is the biggest problem in a metabolic syndrome? Diet or your metabolism? It's the metabolism, right? Diet is not the problem. So when you are diabetic, when you are hypertensive, when you have hypercholesterolemia, don't reduce your food. Go and burn the extra calorie. Walk, exercise. That's more important than reducing the food. Reducing the food to some extent, stop eating junk, eat food and metabolize more because metabolism is the problem, right? I answered it, Samantha. It's a very bad degree of differentiation. So okay, that is not the problem. Metabolism is the problem. Take care of the metabolism, automatically things will take care of, right? This person called it idiopathic and the mom is worried. They went to Ayush. Obviously, the Ayush guy also said, I don't know the reason. It's some random thing. The kid is very huge, right? Okay, then the kid became bigger and bigger and bigger and bigger, right? Huge. The kid became 9 times its size. Such a huge kid it became. When it became 9 times its size, the most irritating person saw the kid. The most irritating person for me and you, most probably in near future, will be the aunties in the next door home, right? So let's keep asking what happened to your child, did need UG, now in MBBS, how it is going, what is your problem, we don't know, right? So then this auntie said, okay, there's a ghost in home. 9 times big kid, right? Thought there's a ghost in the home. When you look at the auntie, who's next door auntie, you'll be happy or frustrated? Obviously, you'll be angry and frustrated, right? They never make a good thing. They always will be angry and frustrated, right? So when you're angry and frustrated, Tom and Jerry taught us you'll become red in color, right? This kid also became angry and this kid became red in color, right? So when you're angry at the auntie, you will scold the auntie or you scold your mother. It all looks like we are going haywire. Just wait for few more minutes. Everything here will make sense. Obviously, you'll scold your mother, right? I don't know why we scold our mother. I don't know when we'll get a spine and tell to the auntie get lost. Hopefully one day we'll have that spine and we'll tell the auntie get lost, right? But maximum she'll call us an arrogant ghost. That's all right. The kid is already like this, huge, angry, red in color, and the mother is already scared. The mom is here. We break everything and we hit the mom and we kill the host. Mom is the host here, right? You kill the mother. That's what happens, right? So this is a story to remember the classical hallmarks of cancer, right? The 8 classical hallmarks of cancer, and it's the best way to remember all the 8 classical hallmarks of cancer. Now, let's relate it to medicine. When you have a tiny story, it's easy to remember and we can relate everything required for us to medicine, right? So now tell me, this kid is a cancer here, right? Now tell me, this tumor or this kid, does it require food for growth or it keeps on growing without food also? Because I reduced the food, kid was growing, made it 0, kid was growing, right? So can I say, in other words, a tumor does not require growth factors for survival? Yes, that's my first hallmark. The first hallmark of cancer is self-sufficiency of growth factors. Okay, it's self-sufficiency of growth factors. That's my first hallmark. A tumor will not require growth factors to grow. Can anyone help me? What's the growth factor for RBC disorder? RBCs. What helps the RBCs to divide and grow? Erythropoietin, right? So if I have a cancer of RBC, erythropoietin is not required for me. It will grow even in the absence of erythropoietin. That's my first hallmark, right? Now, again, we'll go back to the story again. The mom reduced the food intake. Otherwise, the mom is trying to stop the growth, right? Did it work? Mom tried to stop the growth. Did it work? It didn't work. So can I say the tumor, that's a kid here, is not sensitive to growth inhibitory signals? Mom is trying to reduce the growth. That's my second hallmark. Tumors are insensitive to growth inhibitory signals, or we call it a tumor suppressor gene, right? They're insensitive to growth inhibition or the growth inhibitory signals. Okay, we term them as tumor suppressor genes. They don't respond to it, right? They don't respond to it at all. That's my second hallmark. After that, when we go back to the story, the mom reduced the food, the kid became bigger, then constipation. Can I relate or can I call constipation is nothing but stopping a physiological process of excretion? That's what constipation, right? I'm going to relate this to stopping a physiological process of cell death. What is a physiological process of cell death called as? That's the third hallmark of tumor, a physiological process of cell death. Perfect. We call them apoptosis, right? So third, tumors will evade apoptosis. Your tumor cells don't die. They don't die. They keep on dividing. They don't want food. There's no one to suppress it, right? You will have evasion of apoptosis. That's my third hallmark. We're going to relate this to the constipated kid. Once the constipation was there, in this story, the pharmacist didn't work, right? And your banana water didn't work, came to a doctor who called it, this kid has a metabolic problem. I'm going to hook on to the metabolism. The fourth hallmark for me is an alteration in the metabolism, or we'll just name it Warburg's effect. Let's assume that doctor's name is Warburg. We have an effect called as Warburg's effect. So Warburg's effect talks about is just metabolic alterations in the tumor. Okay? The tumor eats differently, the tumor consumes energy differently. That's what we call it as a Warburg's effect, right? That's a fourth hallmark. After the doctor Warburg said, okay, this patient is, I don't know what it is, idiopathy, they went to Ayush. That's what was the story, right? They went to Ayush. Ayush also said, I don't have any way. Though I am studied allopathic medicine, I'm going to practice modern medicine or evidence-based medicine. Ayush is a traditional Indian form of medicine. The only problem with Ayush is it's not regulated. That's the biggest problem. It's not regulated. Warburg, B-U-R-G, okay? It's not regulated. So Ayush also didn't have a problem. So I'm going to compare Ayush to my body's own immunity. Am I right in saying that tumor is a pathogen? Yes or no? Tumor is undoubtedly a pathogen, right? So if it's a pathogen, should my body eliminate it? Should my immunity take care of it? It should, but it's not taking care of it. In other words, tumors escape my self-defense mechanism. Ayush, I'm going to compare it to my self-defense mechanism. That's my fifth hallmark. Tumors evade immune response. Okay, they evade immune response. That's what we do, and we'll see in the subsequent classes how they evade immune response. They are amazing. They evade that so that no one will be able to kill them also, right? So that's my fifth point. So once the tumor evaded immune response, that's when Ayush also said no. The kid grew 6 times in size, and who saw it? The most irritating auntie saw it, and the auntie called them a ghost. I'm going to use the ghost as for the sixth hallmark. The only memory for me, at least for ghosts, is the evade means escape. They escape the immune response. Evade apoptosis. They escape apoptosis. Fine. Okay. So the only memory for me for ghost is the old Ramayana Mahabharata series, right? I'm a Doordarshan born kid, not like YouTube born. So the only movies what we had then was that, right? There'll be a tiny background music and the ghost will grow till the sky. That's my memory of ghost, right? Or the asuras, whatever you want to call it. So in other words, I'm going to relate that ghost nature for and replicative potential. Ghosts grow a lot. They have no limit for division. They keep on growing bigger and bigger and bigger. Like that, tumor has no effect on replication. They have a limitless replicative potential. Okay? They have a limitless replicative potential like a ghost. Okay? That's what it's about. Fine. Samantha, we'll look at every individual hallmark in the subsequent classes because Warburg itself is a half-an-hour lecture. We'll definitely look at everyone. I'll complete almost every Neoplasia on YouTube. Don't worry about it. Fine. Seventh. It's a limitless replicative potential. When the kid saw the auntie, the kid became angry and red in color. Right? What is red color in my body? The red color in my body. What is that? Red color is nothing but your blood, right? So can I say a tumor will require more blood vessels or more blood supply? It will, right? That's my seventh hallmark. We call them neoangiogenesis. Obviously, a tumor has to grow bigger. It will require more blood supply. Tumors will automatically have neoangiogenesis. After the kid became angry, I'm just going back to the story again. The kid moved from its place to the mother's place, sat on the mom, and killed the mom. A tumor moving from its place to a different site. What do you call it? Change in the normalcy. Normalcy is stasis. Change in the normal location. We call it changes meta. We call it metastasis, right? So that's my eighth hallmark here. So the eighth hallmark of cancer is invasion and metastasis, and obviously metastasis will be followed by death. Death is inevitable in cancer, especially when it goes to grade 4, stage 4. You can't do anything. You might have an amazing DM oncology degree, but that's not going to help at all, right? These are the 8 hallmarks of cancer. A tumor does not require cell growth factors. It automatically grows due to mutations. A tumor, you cannot stop the growth, or tumor suppressor genes won't work. Evasion of apoptosis, we compared it with the constipated kid. I'm just going to write whatever we compared it, right? Okay. So the Warburg's effort we compared with the doctor who called the kid having a metabolic disorder. So it's the metabolism of the tumor, and the evasion of immune response. I'm going to compare it to Ayush because for me, Ayush or the indigenous or the first line of defense is being evaded. Limitless replicative potential. We're going to compare it with the anti who called the kid a ghost. Ghost grows without any limit, right? And neoangiogenesis is the blood red angry kid. Okay, it's a red color angry kid for neoangiogenesis, and obviously metastasis moving from the body to others, right? Bobby, I don't call it an acute or chronic. It's one of the steps, that's all. It's just one of the steps here. Any cancer is chronic only. Cancer does not happen acute. It needs at least for all these steps to happen. At least it needs like 5, 6, 7 years of the time. It will not happen today. If a person has cancer today, the problem must have happened somewhere for the past 6, 7 years easily. No cancer happened within the matter of weeks or months. It's always been a year-long process. That's why screening test works. Screening works with cancer because a very long lag time. I can screen in between, and maybe I will be able to reverse the pathogenesis. Fine. So these are the 8 molecular hallmarks. Like in the subsequent classes, I'll be covering all of them. Right. evasion, Samantha. It escapes immune response. That's all. Fine. So just only one thing I didn't compare in the story is this. I said only when the kid became 9 times its size, even the most irritating auntie was able to see the kid, right? So this came once in an exam. Okay, so it said that 1 gram of tumor tissue, any tumor in my body, 1 gram has 10 power 9 cell divisions. This came once in an exam because that's the least amount required for clinical presentation. Okay, it's very tiny. 1 gram will be like, it's 1 gram, right? So I have a tiny bump here. For me to form a tiny bump, I need 10 power 9 cell divisions. 10 power 9 is millions of cells, right? So you see, if you've gone to a surgery posting, you see breast cancer patients of 3-4 centimeter, which means there is 3 into 10 power 9 cells there. Can I say the damage is already done? It's already done, right? 4 centimeter, 5 centimeter breast cancer, I cannot help the patients from death. I can prolong the life, that's all. So the only goal for you, for me, and for the entire world in future is cancers cannot be treated. I want you to know this. There's only one way, because 1 gram has 10 power 9 cells. 10, 50, 20 grams will be huge. I can't do anything. So the only way how I'm going to fight against cancer is, fight is not treatment. I have only two options: prevent, second, early diagnosis. Okay, just prevention, and second, it's going to be early diagnosis. It's very important. How do I prevent? Try to eat healthy, don't smoke, don't drink. Even a single pint of alcohol is also toxic. You might see that Robbins saying that you can drink up to like 30 ml per day. It will help coronary artery disease. There's no human being who has drank 30 ml per day and lived. Single drop of alcohol is problem. Single puff of smoke is a problem. I have to prevent it, right? So try to vaccinate for all the vaccine preventable thing. Your hepatitis B prevents from your hepatocellular carcinoma, liver cancer. HPV prevents from many cancers. Try to vaccinate. Try to avoid the carcinogens, whatever it is, whatever known carcinogens. See, these days there are many carcinogens. Something I cannot avoid. Pollution is also a problem. I cannot avoid, but at least I can stop smoking, right? So avoid the carcinogens. That's the best way prevention. Whatever I can do, I'll do it. Early diagnosis is very important. I'm not going to the epidemiology for an MCQ point of view, but there are two cancers which I'm worried about, or three, right? One is breast cancer. Breast cancer is one of the leading cancer cause of death and the most common cancer throughout the world. Prostate, again, it's very important. Prostatic cancer are a big problem in the Western population, not in our country for now, right? And your oral cavity and the lung. Lung, oral cavity, nasopharynx, oropharynx. These three groups of cancer constitute close to 50% of the entire cancer burden, right? Samantha, it's not like I don't have vaccine for every cancer. HPV, hepatitis B prevents your liver cancer. I have human papillomavirus, protects from your cervical cancer, like that, right? Yeah. Swati, cervical cancer incidence has become less because of two reasons. Pap smear has become good, awareness is there, and HPV vaccine is being done by the Indian government now. They will roll out HPV vaccine as a part of national immunization schedule very soon. And when it becomes mandatory, after 10-15 years, cervical cancer is not a concern at all, right? No sweat. Lung cancer is not the common, but it's definitely, see, I'm not saying the most common for an MCQ point of view. These three groups of cancer, breast, prostate, oral cavity, lung, entire respiratory tract, are the commonest one. The most common is undoubtedly breast cancer for sure, fine. Okay, this is just for commonality for a doctor perspective, not from the student point of view, most common. Because most common keeps changing every year, it keeps changing. So whenever you're going to write the exam, that year, look at the statistics and remember most common, right? Okay. Now, we have to either prevent this or you have to early diagnosis. The only way to early diagnose breast cancer, which I want every person here to read and teach your parents or your sisters if you have one. Self-breast examination. Because only self-breast examination can pick up a breast mass of like 0.5 centimeter or 1 centimeter. A doctor will not be able to examine it. It should be self-breast examination. Though the sensitivity is less, I agree on that. But I have nothing to lose, no money involved, just time and knowledge. So please, after this class, YouTube is there, right? See on YouTube, self-breast examination, and teach to your mother, teach to your sister. I want this to reach every Indian. Harrison says mammography, amazing tool, but my country is so huge. I cannot do mammogram for every woman above 40 years. It's impossible. But knowledge is easy, right? So if you're hesitant to telling to your parents, send the YouTube link and put a message below. Watch this link completely, share to 10 people so that it will reach every Indian. The goal is self-breast examination should be known to every woman above 35-40 years. So if I find a lump which is 1 centimeter or zero point 0.5 centimeter in the breast, treatment is lobectomy. Just remove that quadrant alone, quadrantectomy. Prognosis like 30-35 years. Amazing prognosis. When it becomes 4 centimeter, prognosis drops. Early diagnosis. And if your dad is around 45-50 years, do a PSA. There are lots of reports saying that PSA is good, bad, doesn't matter. PSA is always good. Touch wood, it will be normal. If something is abnormal, 45-50-year-old, prostate does nothing. The role of prostate in men is to support the seminal fluid. That's all. 45-50-year-old, it doesn't have any role. Remove the prostate. Prostatitis, inflammation, hyperplasia, anything can elevate PSA. Do a PSA once in a year or once in 2 years, above 50 years. Again, early diagnosis. Remove it. Because prostate can easily spread to spinal column. If you remember anatomy, there's something called as Bateson's plexus. Prostate is linked with your spinal column, vertebra, it can easily spread. PSA means it's a prostate specific antigen. It's a blood test. Okay. So if you love your mom and dad, today your goal, or at least during the weekend, teach them self-breast examination. And if your dad is above 45-50, just do a PSA test. Once in a year, once in 2 years, do it. If it's normal, completely fine for them. And the only way to do this is stop smoking. This is tough. Stop smoking, stop using tobacco product, anything, right? Anything related to tobacco, anything related to smoking stuff. I'm not going to talk about that because we have Mukesh in movie theaters. If he can't do it and the emphysema lady can't do it, we can't do anything, right? Bobby, any cancer is more common in elderly age group unless it is inherited. If it's inherited, yes, it can happen a little bit early. Okay, so this is a take home message for you. Please, if your parents are a little bit above 45-50, I'm sure your parents will be in that range group of 45 and 50. Teach them self-breast examination and do a PSA level. And if you or any of your friends have any hazardous habit, try to stop it. Because it's said that cancer will be the most common cause of death in 2030, even more common than heart attack. It's WHO report, right? So it's a concern. Okay, that's all of today's lecture. Lecture is about this 8 hallmarks, and like I said, we'll go with all these individual hallmarks separately so that we can complete the entire Neoplasia chapter, right? Any doubts, do let me know. Otherwise, we'll call it a day. Waiting for it, Gautam. Yes, Samant, that's a blood test. All the very best for NEET UG. Okay. See you in the next class. I think next week, Monday and Tuesday and Thursday, we have RRR series. See you there. Bye bye.